Hi guys, thanks for joining again. So I realized one of the things being here in Kenya that I really didn't go into too much detail is what I do as a physical therapist here in Kenya. So here at K2 Adventist Hospital, we're part of the rehab department. So that's physiotherapists, occupational therapists, and I really haven't seen in country a lot of speech therapists. But here instead, there is a profession called an orthopedic technologist, which kind of is in charge. Like their scope of practice involves like splinting and casting patients a lot of times, and they help with like orthopedic surgeons. Anyways, so here we service both an outpatient service and also an inpatient kind of acute care in the hospital wards. And so, we kind of see a lot of musculoskeletal, like back pain, the knee pain, degenerative conditions like arthritis for like knee and shoulder and back, those type of situations that, you typically see anywhere in the world. But being here, there are some unusual cases that I normally would not see in the US, mainly dealing with fractures. So because we don't have an orthopedic technologist department, but it still kind of falls under our rehab department, we still kind of help with especially managing the fractures. So typically what happens is a patient will either come through the outpatient department or OPD, and there's a fracture that the clinician finds after an x-ray is done, and so they send them to our department. We consult with the medical officer or the doctor, and we figure out the next best step for them. Sometimes it's referring for surgery. Other times we're just manipulating and doing casting in our departments. So, situations like a patient falling. We had one situation, a patient fell, broke the humerus, and it was definitely out of place. So the doctor was called, we consulted, he did injection for pain, and then we just manipulated the arm to the best position we could, and then we just casted that arm. In that situation is the best solution for this patient. Thankfully, it's held in a good position, and so she's doing well now. There are other unusual situations, especially like with fractures or traumas that happen in the wards or in the inpatient side. There are several patients that we've seen where they've had an accident and they fractured a femur, right? And it's an open fracture. So, bone out of the skin and, it's returned, but there's an open wound. And here, one of the main things that we're trying to that we kind of wrestle with is people wanting to do like traditional medicine here in the villages. So what that consists of usually kind of herbs or something, and they'll like massage the areas of injury for healing. Now, we try to counsel patients and their families as best we can, but they have some autonomy and they may just refuse and they just want to go AMA and go back home despite having an open fracture. And so there's situations where, we have to allow them to choose what they want to do. So, they'll agree to put at least a back slab with a plaster. So I've had situations where I walked in, we've had to unravel their dressings, and it smells like it's starting to go bad or being infected with the wounds. We try to soak it with iodine. We try to clean it up as best we can, put some gauze on it, and then we wrap it, and then we put a plaster, we call it POP, and we make a back slab out of it on the leg. And we try to counsel them as much as we can if they can stay to do surgery, if they need to be operated on. But again, we just have to allow patients to do what they want to do, so we can't force patients. So in terms of physical therapy, it is a little bit unusual because again, there are some things that we commonly would see in the US, but there are also these situations like managing fractures that are a little bit more that we kind of have to assist with, being in the situation we are here in Kenya. Some other situations, obviously, we see patients with stroke, but unfortunately with them, we often don't see them right away. So oftentimes with the consequences of having a stroke, we see patients with a lot more severity with like contractures that we normally wouldn't see as much in the States because we typically see them right away after a stroke. So yeah, there's those kind of different situations I want to kind of share with you in terms of physical therapy, just some of the differences and some of the similarities that I've seen in my practice, both here in Kenya and also in the US. But anyways, I hope you found that interesting, and we hope to see you next time. Thanks for listening. Bye.